Okay, welcome back. JD Dudum Chiropractic. This is part 2 of our arthritis video. So to recap part 1, we talked about the 2 different types of arthritis. Degenerative and inflammatory. Now we're going to talk about degenerative today, so we'll leave that aside. Let's talk, remember, inflammatory is multiple joints, inflammation, whole body. We're going to get to that part 3, so make sure you watch that video. Let's stick with the degenerative arthritis for today. So in part 1, we talked about degeneration, arthritis, significant trauma. So the multiple names for degenerative arthritis are osteoarthritis, degenerative disc disease, degenerative joint disease. So these are the different names. They all mean very similar things. Your joints aren't moving. You had a significant trauma. You fell off a ladder. You had a huge car accident. Or maybe you had a fender bender. This could have been 10, 20, 30 years ago. When those joints lack the movement, your body responds. It's a normal response. And it starts to hold and clamp down the joints together. So weeks, months, and years later, what will happen, the bones start to grow together. They become a little bit more brittle. They're not as fluid, or they're not as soft, and they don't have as much motion as they used to. So they become brittle. You get more scar tissue. That's when the muscles get tighter and tighter over time. And that's how you get pain. So when people walk into our office with pain, different areas, we do a great job of asking you questions. We want to hear your story. How did you get to be where you are today? That's a huge lead to tell us, is there a chance of degenerative arthritis? An x-ray shows that. It shows if the bone is nice and square, has a defined outline, or it shows if the bone's rocky, if the bone's starting to grow and secure the joint, and more brittle. That's going to lead to pain. So if you're suffering from pain, you can't figure out why. If you've been told you have degeneration, you don't know what that means. Or you're looking for something that's a little more natural versus getting shots, or you don't want to live with the idea of having surgery, give our office a call. We'll figure out exactly what's going on, how you got to be where you are, and what's the best solution moving forward. Again, I'm JD Dudum with Dudum Chiropractic. Thanks for watching. Make sure you check out part 3, and I look forward to hearing from you. Thanks.